Welcome to the Thyroidless Life podcast with me, Dr. Rebecca Warren. This podcast is for you if you've been diagnosed with a thyroid disorder, think you might have a thyroid disorder, or healing after thyroidectomy. I'm doing this podcast because of my own personal health journey of being diagnosed with thyroid cancer, getting my thyroid cut out, getting high-dose radiation, and being left with no answers when my health started to deteriorate quickly. It wasn't until I drew a line in the sand that my health transformed, and now I've dedicated my life to sharing this information so others don't have to go down that same path. My hope is that you never feel alone on your health journey and that you understand how incredible your body is, that it's not working against you, it's working with you, and it wants to be well. All right, so let's go ahead and jump right in to the clickbait articles on thyroid med use and osteoporosis, osteopenia. Now, depending on where you see the article, it's just interesting because some of the titles are like, the second most prescribed drug out there is going to cause, bone loss. So it makes it seem like this can happen to anyone. If you're 21 years old, it can happen to you. There's other articles that say clearly it's for an older population. And I do think this is a very important conversation to have, especially since thyroid medication, like thyroid meds, is prescribed to 7% of the American population. Now, I know I have a lot of you guys that are from other countries. It's getting just as bad there. I interact with people in my community. I've coached people in other countries. It's getting bad across the board because the idea is like, oh, you have a thyroid issue? No problem. Let's just gut it out and get you on a pill, or just get you on a pill and send you on your way. What has happened, honestly, for my honest opinion, is the laziness in the medical system. The fact that they are like, well, we've got it, we have something that quote unquote works. Why change it when we have millions of people worldwide that are still suffering because the underlying issues are not addressed? But I digress. In regards to thyroid meds and this study, I think it's an important conversation to have because I'm going to share with you the things I agree with, the things that I think are lacking, and the things that I don't think are right or correct or that we're missing so that you can have a full picture. Now, I've been doing this for my own health for over 2 decades, over 10 years working with men and women. And man, there's always, if you're not careful, you can honestly find a talking head or a study or an article to back any type of idea out there. I always share with my clients how when I first started off with what happened to me and my thyroid missing and my hormones were off, it was like a desert of information. I could not find anything really to help me. I had to dig deep. And we're at a day and age where it's not even an abundance, it's an overabundance. It is a fire hydrant worth of information out there. It's just overwhelming. And if you're not steady and look at the foundations about honestly, the truths about our body and our body's ability to heal and what it looks like to be well, if you don't stand on steady ground, it'll be so easy to be swayed. I remember when Times magazine came out with butter on their front cover. I don't even remember what year this was, and they were just demonizing butter. And I remember thinking okay, I could care less what Time magazine has to say about butter. I know that that's going to be better for me than something made in a lab. And then I remember when, they had the cover of butter's actually great for you 5-10 years later. And the truth is, you just have to understand the truth about health and healing and function and disease, what it means to get your cell well. You got to understand toxicity and just adaptability. If you come back to the fact that your body's created to heal itself, but more times than not, it's bombarded by stressors, and its adaptability, its ability to heal has now decreased, which causes dysregulation at the cell and tissue level, which creates disease. You've got to know that your body's created to heal itself, though. You've got to understand that you need a full picture, that you don't work off of just symptoms, but how your body's functioning, right? What's how you're getting optimal You look at a full picture, a holistic view of health is the most important thing. I mean, I think COVID was one thing that was very shocking for people to understand. There's people that were young or that they looked well and, well, they ran marathons. I mean, you can run and still not be well, still be inflamed, still have cardiac markers that are dysregulated. There's things about how we look, and then there's things about how our body is healing and functioning. And those are two separate things. So when you come across these articles, like, look at the data, look at, like, okay, what did they do? What were they looking at? And this is something I will say, Dr. Bianco, I'm going to bring him up a few times in this episode because we did discuss like osteoporosis and TSH suppression, but that was something in his book. This is, if you haven't listened to that episode, he's done 35 years of research. He was former president of the American Thyroid Association. He's a practicing doctor, but that was something that he really, just nails home, is that depending on the questions you ask is the type of results you're going to get in your studies. If you're not asking the right questions, then you're going to get different results, right? So that's the one thing we have to take in consideration when you're looking at these studies, is looking at what are they looking at, how are they doing it, and what really is going on in this study. And that's what I'm going to share with you. Again, the study, I do agree with some things of the study. I disagree with other things, or I more think that we don't have full information to really make this definitive answer. But I do think there's some important information to take from this study, but also important things to question about this study. So let's go ahead and go in. So I will say I had to go to different areas to find information because I couldn't get access to the actual. That's the frustrating thing. You got these articles and they're like, oh my gosh, this study says if you eat meat, you're going to have a heart attack in 5 days. And then you go and all you have access to is abstracts and it's not even very definitive. And it's like, okay, this is not chill out, right? But so I'm going to have to go between different pages to kind of give you guys the information to get an overall look of what the study's about. So what they used the Baltimore Longitudinal Study of Aging, which is an observational cohort of community-dwelling older adults. So the participants were over the age of 35, with the average age being around 73, I believe, around in the 70s, right? And the follow-up period for the study was 6.3 years. And they had participants. There was 81 levothyroxine users and 364 non-thyroid med users. Now, what they attempted to do in this study is they employed a propensity score matching, so 1 to 5. So to match T4 users with non-users according to relative baselines, right? In regards to characteristics and risk factors like age. They talked about age, gender, BMI, race, history of alcohol intake, smoking, multi-pharmacies, and a baseline TSH serum. So what that means, that whole like propensity 1 to 5. So their goal was, and that they were having a 1 to 5 ratio. So for every one T4 user, it's matched with 5 non-T4 users who have similar characteristics. This matching is in hopes to try to get the groups to be comparable and not have as many variables. So that's what that means. But going back to kind of what they're finding in that study. Well, in regards to the 81 users, I do think this is important. Of the 81 users, 32 were male, 49 were female. And of the non-users, 364 non-users, 148 were male, and 216 were female. Okay? And they had a thyrotropin level of 2.35. Now, what they concluded in their study is this longitudinal loss of bone mass and density was greater among LT4 users, so levothyroxine T4 only users, and the more pronounced effects were at higher levels of free T4 suggests, according to their data, that T4 use may be associated with the relative excess of thyroid hormones in some older adults that are on this therapy. All right, so let's go ahead and jump into some of the, not necessarily what I disagree with, but what I think is lacking information that I think is very important to include in these types of studies. Because again, a lot of you guys might actually need thyroid meds. You've lost your thyroid, or again, you've had Hashimoto's and it's destroyed your thyroid, or you've been on it for a really long time. My biggest issue with usually these studies, and I did bring this up to Dr. Bianco because again, he's been in the research. And we talked about TSH suppression because those of us without a thyroid tend to feel better with a very suppressed TSH. And he was like, oh, it's so dangerous and all these things. But I asked him, like, is the TSH suppression in and of itself dangerous, or is it the levels of T3? Because I do agree that high levels of T3 or over the range levels of T3 is very dangerous if you have all the signs and symptoms that it's, you have a hyper like this hyper response, not responses. I don't want to call it hyperthyroidism because if it's caused by the thyroid med, it's not hyperthyroidism. You just have too much meds, right? And so the one thing that we discussed was how a lot of these studies don't look at T3. And I think that's just so interesting because T3 is the active thyroid hormone. That's what binds to the cell. And in this study, they do reference, free T4, which I think is really interesting. But there's no talk about T3 and the effects of T3 in all of this, which is very important. It's T3 that does that. So why not look at that? And that's the conversation I had with Dr. Bianco is like, so there is a possibility, because every body is different, that someone has a TSH, which I'm going to touch on this towards the end of today's episode, is they're on thyroid meds that they might actually not need it. And there's millions of Americans where that's the case. And so there's a possibility that your TSH just naturally might need to be a little bit higher, like a 2.7, but your other levels are fine. But because, again, like it's this laziness of truly understanding each individual body when it comes to our thyroid hormones. Here you have a woman that comes in and she's just tired and she's losing some hair, and the doctor's like, oh, okay, yeah, let's get you on thyroid meds. When in actuality, she doesn't need it. Her issue is that she's under eating protein. She has low iron, which is causing the hair loss. And she's having a tough time with menopause because her adrenals were wrecked, because she had previous sex hormone issues in the past, right? So my thing is, there is a person that may be on thyroid meds that in actuality shouldn't be on thyroid meds. And then there's people that need to be on thyroid meds that should be on it, and their active hormone T3 shows that they're good and they're fine. And that's my concern with this, because I will say what we know and understand about T3 is that it affects every cell in the body. It affects your body's ability to build bone, to build muscle, to absorb your food. It affects everything. It's like putting your foot to the gas pedal and making that car go. That's what T3 is. And that's why you have low T3, no T3, you lose your thyroid and don't do anything. You're literally going to die because you need T3. So I say all of that because there's this conversation about hyperthyroidism or too much T4 and this issue with osteoporosis and all of that. But what if there's low T3? And there's this study, I'm just using one, it's in the Journal of Clinical Medicine. It talks about thyroid hormone diseases and osteoporosis. And I found this really interesting kind of breakdown that it talks about here, where it says in adults, over hypothyroidism induces a low bone turnover with a prolonged bone remodeling cycle, which is caused by reduced osteoclastic bone reabsorption together with decreased osteoblastic activity. That was a mouthful for me to say. But what are we looking at here? Since when we're looking at low bone turnover, so in hypothyroidism, the overall process of bone remodeling slows down. Everything slows down. So what does that mean? It means that the time it takes to complete a cycle of bone breaking down and rebuilding is extended because both of those processes are slowed down. And then the osteoclast, the cells that break down old bone, become less active, resulting in less bone reabsorption. And then what else is affected? Osteoblastic activity, which is the cells that form new bone. They also become less active, leading to reduced bone formation. So all that to say, since both the reabsorption and the formation are reduced when it comes to like bone activity, the overall bone remodeling process in hypothyroidism is slowed down. When this might initially seem like, oh, okay, that's not too bad, you don't have all this stuff going on, it is bad because it can result in a weaker bone structure over time. How are you going to create strong bones with low T3, no energy, no ATP? Everything slows down. So when we're looking at these studies, I agree, there are people that shouldn't be on thyroid meds. I talk about this often. You have, especially as a woman, if you have X, Y, and Z, okay, fine. Yeah, I'll put you on, thyroid meds. But then there's people that really, really need it. Those that had their thyroid removed, or against someone who has had this issue for a really long time, and then they're put on thyroid meds and they're suboptimal. Like they have all the signs and symptoms that things are not right, and doctors are like, oh, whatever, this is the way it's supposed to be. So it's such an interesting situation. It's like, okay, if we don't see active free T3 and these metabolic numbers improving, like all the signs and symptoms of a good kind of well-functioning, energized body, then you know what? That hypothyroidism, is it possible it's creating the weakened bones? That's just as dangerous. And there's more factors to it that I think is really important to take into consideration. Okay. So that's one really major thing that just frustrates me is like, no, I want to see the people that are really having the issues, like what's their T3 doing? And is it high or over the range? Well, yeah, man, that makes sense. I think it's really interesting how different our bodies can be. Our TSH could be doing something differently than, what the rest of our body is doing, because TSH it's affected by the pituitary, and you have its own system there that can activate its own thyroid hormone. So that's really important to take into consideration with this study. Another thing that I think is a kind of really frustrating thing that's not talked about either is other contributing factors that are overlooked. So, okay, they looked at these kind of like medical approaches to, bone loss and osteoporosis, but why don't we talk about some big, major lifestyle related ones, like protein intake, like weight-bearing exercises, and activity level, like your vitamin D status. And I think that's something that I really do think it's missing when we're looking at women and utilizing thyroid meds, aside from, the population that really shouldn't be on it and they're just put on it. The other population of those that need it and are just treated. But then there's these other factors that I can tell you this. I mean, hundreds of women I've worked with. And I don't know, I feel like I can count on one hand how many were eating adequate protein, that were doing adequate weight-bearing exercises while also nourishing themselves well. And as you age, especially when you go into postmenopause, your absorption and utilization of the protein to make those essential amino acids decrease. This is a really big deal. And then we have so many people that for the last 5, maybe even 10 years plus are going with no meat, decreasing kind of their animal protein absorption, going to more plant-based, but not eating enough to make up those essential amino acids, not supplementing in the areas that they need it. This is important information that should be known, should be looked at, and should be optimized. So I want to talk about some of these other risk factors that I think we like when you see all these studies that we really need to take into consideration in regards to contributing to things like osteoporosis and osteopenia. So right now, statistically, approximately 30% of postmenopausal women have osteoporosis, while 54% have osteopenia. And so one big kind of contributing factor they say is this rapid decline of estrogen that accelerates this bone density loss, as estrogen is a big part of that. But I'm going to take it a step further because I have worked with so many women in postmenopause that when we go back in their health history 5, 10, 30 years, so many women had sex hormone issues. So many women had unaddressed, so many hysterectomies, so many, just deal with it, that were bleeding through or like having irregular cycles. We normalized so many uncommon symptoms and disease processes for women, and we still freaking do that. Like, I feel like I don't think it's every single doctor. Understand, I'm not, saying every doctor's like this, but our medical system there's gender bias. And you can see it over and over again in the way that women's health care is treated, especially when it comes to our menstrual cycles. It's like, oh, your sex drive, who cares? Oh, your period, who cares? It's like, just deal with it. That's normal. How you feel. It's just like they write it off as PMS. And then here we go depleting our adrenals and our ability to adapt so that when we go into menopause, when we're dependent on our hypothalamus, pituitary, and adrenal axis, we need our adrenals to kind of step up to the plate to create these sex hormones. It's not there. So is it just menopause, or is it that so many women within a broken system were not supported? How many women were put on birth control because they had acne or they were in pain, or which, rightfully so. Like I've worked with quite a few women with endometriosis, and I completely understand how painful it is. If you have no choice but to get on birth control, well, yeah, I understand that. But what is really happening here, right? Like, how much of it is our mistreatment of our symptoms and our dysregulation, and then we're kind of set into menopause. And then what ends up happening is if you treat enough women like this, they talk with their mom, they talk with their sister, they talk with their small group at church, and everyone else is kind of going through the same thing. So this must be normal. No, it's just common. And I think that's really important because I've worked with a lot of women that have been able to successfully come off bioidentical and feel fantastic. And we had to address things that started, again, decades before. Another thing I think is really interesting, because this is something that my husband and I, we had a radio show here in our city, and during COVID, we really talked about vitamin D, and we got under a lot of like trouble, and it was like threatened we couldn't talk about that. Now you look at all these studies on vitamin D and its ability to help fight off COVID and the immune system and all of this. But vitamin D is a hormone, and we know that vitamin D is critical for calcium absorption in the intestines. So without adequate vitamin D, less calcium is absorbed, leading to the body pulling calcium from bones to maintain blood calcium levels. Now, why do we have low vitamin D? There's so many reasons. We're more inflamed. Our cell receptors aren't as sensitive. Our liver is taxed. We don't go outside. I'll never forget, I was doing a training by another doctor about women's hormones, and I remember she painted a picture. She was like, hey, take this into consideration as a woman, and let's say you have kids and you work. And she kind of like talked about a whole day, and at the end she was like, did you realize that the only sunlight or the only interaction with like sun was getting in and out of the car? And I was like, I remember thinking years ago, like, that is sickening. That's crazy that we're just such an inside culture that we don't even get as much vitamin D. And now there's all this scare and the sunscreen use and all this stuff. Vitamin D is essential for osteoporosis, for osteopenia, for adequate calcium levels. That's really chronic vitamin D deficiency across the board is going to weaken that bone structure, and it increases your risk of fractures and reduced bone density. And again, I've had women that over time after working on their gut and liver can come off of vitamin D, but it's really important to know your levels. It's it's like a $20, $30 test, powerful test to know what those levels are, because it's not just about like bone, it's your overall health, your immune system health. Now, weight-bearing exercises. So bones get stronger due to mechanical stress. That is how they respond. They get stronger to that. So weight-bearing exercise stimulate the osteoblast activity, the cells that will build up bone. And postmenopausal women often reduce physical activity, whether it's because you just don't do it or because you're tired, or let's say you have low T3, you've got joint pain, whatever it may be. But one of the most powerful things you can do is to be strong, to create muscle. Muscle is an organ that impacts hormones. And that is I want to know how many of those people were doing weight-bearing exercises. How many of them were doing it regularly, staying active versus staying inside all the time and not doing that. Now, one more thing I'm going to touch on here about osteoporosis and osteopenia is low protein intake. Woo, women struggle with being well nourished. And you know what? I don't blame a lot of the women I work with in my community that struggle with this. We have had decades worth of messaging of calories in, calories out, like eat like a bird. And it's crazy because for a lot of you guys, you've been doing that for decades and it's not working anymore, if it even worked at all, because it's going to stress out your hormones overall. I have Jennifer, who was a coaching client of mine. She's kind of just does wellness with me now. And she had lost 25 pounds, which this is how I am. Listen, this is how I work. My job isn't to heal you, fix you, treat you. My job is to support you, educate, empower you, help you remove stressors. So a lot of the times when men and women I've worked with through the years have come back and said like, oh my gosh, I saw this, I'm just as surprised as they are. That's incredible. I'm in awe of the human body. But Jennifer came to see me. She was very active, working out. She wanted to just kind of like work on her hormones. And Jennifer lost 25 pounds. And I was like, oh my gosh, Jennifer, that's amazing. So what was it? What did that? And she laughed and she said, you're going to laugh. It's because you told me to work out less and eat more. Because she was overworking out and undernourishing herself. She had to nourish yourself with adequate protein intake, adequate fat for those essential fatty acids, essential amino acids, and she lost it. And it takes time for a lot. I will say my older population, it's harder for them because they're like, I cannot believe you're telling me to eat more. I know, but trust me. Now, protein is so important because protein forms about 50% of the bone's structure. It is necessary for bone matrix, which provides like that scaffold for calcium and other minerals. Inadequate protein disrupts the repair and maintenance of bone tissue, and chronic low protein intake contributes to weaker bones. It disrupts healing. You lose muscle mass, which across the board increases your risk of falls. I will say, there's a lot of these functional trainers, which I have a bone to pick with a lot of these trainers online, and not all of them. There's some really cool, great ones out there, but a lot of these personal trainers, a lot of these registered dietitians, it's just about weight loss, right? It's about, just, eat this, when it should really be about hormone health. It should be about overall health, decreasing inflammation, mitochondrial health. Again, the body's ability to heal. But we were just fed this idea that just eat less, work out more, and that's all that matters. And that is not right. But there are these functional trainers that I love, and they do like a lot of like movements. And one of the most simple things that you can do as you age is doing exercises. Like I remember there's a test that they can do where you're able to stand up and down, or able to come up the floor a certain way, and doing that efficiently decreases your risks of dangerous falls significantly. Like, that's important. Movement, having adequate protein intake, going outside, getting your vitamin D levels up. Another thing I want to say about protein is, like, I'm telling you, if you're not tracking macros at least for a week to see how you're feeding yourself, you don't know. And I know a lot of there's a lot of intuitive eaters, which I love that. That's where I usually try to get the women in my community, my Thyroid Inner Circle, and my one-on-one coaching clients. I try to get them to that point, right? But a lot of times you are a rushing woman. What's that? Rushing woman syndrome, when you're going. And a lot of times you might be eating healthier, cleaner, but you're under eating. And I remember years ago, I sat with a woman and I made her track her protein. And we were lucky if she was getting 50, 60 grams of protein in a day, which is very common for me to see. And I looked up the World Health Organization, like what their kind of recommendations are. And to avoid like worldwide starvation, their goal is 50 grams. And I'm like, you have access to food, more access to food. You have the ability to eat these foods, to keep yourself well nourished, and you're not even hitting the limits for worldwide recommendations. Like, that's a really big deal. So again, these are these factors, including like the thyroid hormones and all of this, that I think is really important. But let's go back as we wrap up here. Let me talk about what I do agree with, okay? What I do agree with, and I have a study here that I pulled up. Let me go to that window. Levothyroxine replacement therapy and overuse, a timely diagnostic approach. This was published in 2018. Now, right now in America, 23 plus million people on thyroid meds. We're looking at top 5 most prescribed medication. I think it's dropped down because of blood sugar issues and statin medications, but it is heavily prescribed, and it's kind of treated as no big deal. My issue with this is that, there might be a reason that you have low thyroid hormones that can be easily addressed if you understood that you got to get down to the cause. But what ends up happening is you get on thyroid meds, it makes you feel better. Why? Because what is it doing? It's not correcting an issue. It's not regulating things. It's not fixing anything. It's giving you the end hormones. So here you go. You walk out that door. I feel great. While the issue still persists and continues to destroy your thyroid and thyroid function and thyroid hormone balance. This is a problem. It bothers me so bad. But in that study, they talk about how 90% of patients remain on T4 long term, but may lack a definitive diagnosis of hypothyroidism. Think about how crazy it is. Like, when you walk in, you get on this thyroid med. The goal is this. Congrats. You're going to be a pharmaceutical patient for the rest of your life. And those of us that are the thyroid removed, same thing, right? We got it. Listen, I love my thyroid meds now because I need it. And I like to see what's best for me and work with whatever I can in optimizing that for myself. But it's crazy to think that the medical system is so flippant about a hormone that affects every cell in the body. They think it's no big deal to just be on a pill for the rest of your life. And so in this study, what they looked at is 291 patients, 84% female, with an average age of 48 years old on T4 for at least 1 year, and they were studied. They paused T4 for 6 to 8 weeks, and thyroid function tests, TSH and free T4, were reevaluated, and a TSH above a 4.5 post-pause indicated hypothyroidism. So 39% of patients required T4, okay, while 61% of patients remained euthyroid. So they remained fine. There's no significant differences in sex, age, BMI, duration of therapy, or TSH free T4 levels between the group. So their conclusion in this study is that these findings suggest considerable overuse of thyroxine therapy. The results underlying the initial need to establish the diagnosis firmly. What? So what they're saying is they should find out what's causing it. Anyways, to establish the diagnosis firmly before treatment initiation and to undertake periodic evaluation of all patients on chronic T4 treatment as to the necessity for treatment continuation. In all patients on long-term T4 therapy in whom the diagnosis has not been definitively established, it appears rational to introduce a 6 to 8 week period of T4 replacement therapy discontinuation and followed by TSH results as a first line of approach, a procedure that could be implemented as a part of common strategy among the scientific community to decrease T4 overuse. Okay, as we wrap up here, that's not for those of you guys without a thyroid. I will wrap up with that. But what this means is you've got to understand, you have a thyroid that's dysregulated. It's a Band-Aid to get on that T4. And thyroid, the things that cause the thyroid to become dysregular will cause many other things over time to become dysregular. And the thing is, you're never going to realize that it's connected. Your sex hormones or your gut issues or your gallbladder or the nerve pain or the RA, like these are all things. And there's more. I don't know what is not affected by the things that can cause your thyroid to become dysregulated. But again, you're never going to know it's connected to that because then you'll go to a GI specialist, you go to an OBGYN, and they all kind of work on their own thing. And the goal should be to understand what's causing that thyroid to become dysregulated and to get there. Now, I am of the person and I am of the type. I use over-the-counter, a lot of people I work with use supplementation and glandulars to support their thyroid hormones. But I am of the person, because I know what this is like, that if your T3 is it's just crashed, right? Like you just have low hormones. I do believe it's beneficial to help get your head above water to utilize hormones. But at that point, once you start to feel better, most people are like, okay, so now my thyroid meds work or this thyroid gland works. And I mean, it works because it's giving you hormones. But it's, again, when you start to feel better, then you start working on identifying the cause, which can be years and, it could take years. It's like peeling an onion. But you can see incredible results 5 years down the road by starting that journey, then staying on a pill for the rest of your life and developing more issues. Now, for those of you guys that don't have a thyroid, listen, it's a necessity. It's life or death for us, right? And before you start running and getting scared, make sure you're getting full thyroid panels done. Make sure that you're on optimal hormones according to how you feel and function. Obviously, keep an eye on like your bone density scans and all of that, but work on the real factors that affect that bone density, that bone strengthening, that bone growth, like we discussed here. You don't have to end up like a statistic, like in the black and white data. You are an individual, but this should be, especially for those of us with a thyroid, a kind of awakening of understanding that we need to prioritize our overall health and not just think that everything's taken care of just because we had our thyroid removed and we're on a pill. So guys, I'm so glad we were able to do today's episode. Please, if you enjoy this podcast, leave a 5-star review. Let me know you're listening, especially since I'm back here. Please join my newsletter. Go to drrebeccawarren.com. See if, I have my Thyroid in a Circle community. If you want to work with me one-on-one, if there might be a wait list, there might be an opportunity to apply, whatever it may be, you can just go to my website and find that out there. And I'll see you guys next time.